Good morning, good morning, good morning. Adjust my camera just a little bit. Welcome, welcome, welcome. There we go, that's a little bit better. Hello and welcome to Mobility Magic on a Monday morning, if you're joining us for the first time. And if you're joining us, because you join us every week, welcome. Today is a packed session, we've got lots to go through. We're going to start with some neck work. We're going to work through to the ankles and the hips, and hopefully be able to cover off a little bit of low back as well. I'm just going to adjust my camera, sorry to everyone, a little bit of an issue setting up early on. So, as I say, we are going to do some neck work, some low back work, and some ankles. So, you're going to need a lacrosse ball. You're also going to need probably a small towel or a band that works really well for a little bit of neck traction as well. As usual, if you have any comments, feedback, please leave it to the end of the session. We'd love to hear from you all because it helps shape the sessions and keep the content interesting for future sessions and current sessions too. We'll put the video for this session after on the replay as well, so you can catch up if you don't see all the content. But for now, we're going to start with a little bit of a lacrosse ball action on the neck. So I'm going to add a little bit more of the wall over here. And we're going to place the lacrosse ball on the base of our skull, on the occipital. So if you were to take your thumbs, put them on the bony prominence at the base of your skull, just around that area, you'll feel maybe a little bit of tenderness. And we're going to start there today. At the other end of the body, you can either manually use your thumbs for this and just kind of hook underneath and slightly lift up, pushing your head back into your thumbs, or alternatively you can use your lacrosse ball, which we can actually put against the wall. And if you're lucky enough to have one of those lacrosse balls that's shaped like a peanut and has two knobbly bits on either side, then you can use that, or you can balance the ball on the one side in that position we just discussed, at the base of the occipitals there, into that one tender spot you have, and then obviously do the other side too. Now, I'd be very careful with this position. Make sure you're not exactly on the C-spine, you're not applying too much pressure. And the key for this is to tuck your chin. So imagine you're just giving yourself a double chin. Make sure that you're not too unstable in that position. Make sure that you're only applying about a 6 to 7 out of 10 in terms of pressure as well. You don't want to damage anything, don't want to cause too much pressure at one time. After all, with all sessions, we're after frequency over intensity. So you want to keep the intensity low. You're going to move to a new spot. Once you find that kind of subsides, make sure you're breathing. Make sure that you're keeping your chin tucked. Make sure you're applying enough pressure. So this is something you can do quite regularly. Release a lot of tension in the neck, headaches and such, and also release some of the tension in the shoulders too. Let's just, for time's sake, switch. You can spend a few minutes on that actually. You can probably spend about 3 to 4 minutes aside if you really wanted to, with a little bit of light pressure. You can also do it on the floor as well. I'm going to show you a few variations today that are going to help with that, especially with the traction piece as well. So if you find it better to lay on the floor and do this, you can even use a yoga brick too, that also works. Laying on the floor is also going to allow you to modulate the pressure a little bit for the position. But again, I'm just keeping my chin tucked as I'm in this position. And if you feel it in your forehead while you're doing this, is a good sign that you need to do this more often, as this particular superficial back now that kind of wraps all the way around and down under the heels, which we're going to be tackling today, actually connects on the front as well of the base of the skull. So, on the front of the skull. So, done a little bit of work there. You might find yourself a little bit kind of loose already in that kind of neck area. So it's a good idea to do a check-in and just kind of see how that neck feels. Now, second part to this is you can do this on the floor, or you can do this standing. I'm going to do it standing. Some people prefer it in a laying position. I'm just going to put this crossbar down for a sec. In a laying position, now towel's going to be really useful for this because it's going to allow you to apply a little bit of traction upwards. So if you have like a very small kind of dish towel, or like this, which is kind of like a sweat towel, or something similar, or even just something you can double up. I even use a band occasionally, that works too. We're going to apply a little bit of traction upwards. So if you are laying on the floor, and I just show you the position, we would be in this position, And it can be easier for some people to apply the right amount of pressure. Now, we're going to be pulling down towards our hips and slowly lifting, keeping our chin slightly tucked towards our forehead. Just trying to create some lengthening, trying to create some space in between that cervical spine as well. And what you'll notice is as you lift towards being in line with your nose, you'll find that your T-spine and your shoulders and a little bit of levator scap stretch, that's the muscle that sits between the neck and the shoulder, starts to elevate as well. You start to feel some tension there. Now this can also be done standing, and I'm going to get close to the camera so you can kind of see what I'm going to do. If you're going to stay on the ground, you can follow along to this too, but I'm tractioning, and just again imagine that I'm on the ground, I'm tractioning forwards, keeping that chin tucked, and up. If you want to do this standing, you can. You're going to do that 3 or 4 times. So tractioning up, we're relaxing, we're getting down, pulling a little bit more, so we're tractioning more. Get some lengthening, keeping that head tucked, we're kind of leaning back, and we're just pulling out this way. If you're on the floor, you're obviously tractioning vertically. I'm standing up, so I'm going to traction slightly forward and up. I could also start to turn my head. So this time I'm going to turn so you can see me, so you can see the orientation of this particular stretch. So I'm tractioning up and forward, and I'm starting to pull the towel upwards. You can use your hands if you don't have a towel, but it's probably not as effective. This is often useful if you have a band as well. So we're just pulling forward and up, keeping that chin tucked. You might find a little bit of a stretch on one side of your shoulder. We're pulling forward and lifting up, slightly turning our head, keeping our chin tucked, and then back. So you can do the same thing. So this one's going to stay still, this one's going to lift up. We're tractioning forwards. I'm just turning my head slightly, and then back to center. So I'm just tractioning forwards with both hands, leaning my head to the side as I traction. And this time I'm going to add in a slight turn of the head, so my head's going to turn to the side. So again, this is really useful just to get rid of that excess tension. So we've done a little bit of work on releasing the neck with the lacrosse ball. If you tuned in, we're starting the neck and then working to the feet and then kind of coming back into the middle. So traction in the neck often helps release some of the tension in the feet, the ankles and so on, especially if you have any issues built up from tension of wearing heels, etc. So we are tractioning forwards and then over, and this time we're going to turn our head too. And you may even feel this very deeply in the musculature of the shoulder. So I'm tractioning. So again, if I'm turning to my left, I'm anchoring with this left hand. I'm turning and lifting with the right hand, all the while keeping that pressure and my chin tucked. So it's a bit like patting your head and rubbing your belly. Turning all the way. So I'm anchoring with my right hand now, lifting with my left. I'm turning my head, leaning my head over, pulling forward and up, and I'm just turning my body ever so slightly as I traction forward. So again, 3 positions for this one. We're tractioning forward and up, we're tractioning and turning our head to the side, and then we're tractioning and we're turning our head and kind of towards our armpit, giving it a little bit of a snap. So let's transfer to the bench now, to the floor now with our lacrosse ball. Now we've kind of loosened up our neck. We'll add some stability at the end for that. But we're going to take our lacrosse ball, we're going to bring it to the floor. If you've done this before, you kind of know what we're going to do here. We're going to start at the base of the big toe. And first thing, we're going to want to use a little bit of an assessment, just kind of see how we feel. So we're going to roll front to back with a little bit of light pressure, probably 3 out of 10, not too much, not looking to bruise it. And then you're going to roll into the middle, and then you're going to roll to the other side. And again, all we're doing here is just kind of assessing where we need most pressure. So you're just going to push or apply pressure about 7 out of 10 at the base of the big toe. And again, if you didn't need it in this area, you can skip over. I'm just applying some direct pressure downwards, and I'm going to bring my toes up, splay them out nice and wide if you can, and then I'm going to bring it down and up. And if I find that it's not so much needed there, I can either move or I can apply a little bit more pressure. Again, we're not trying to tenderize the feet here. It might feel like that. We're just trying to get that tissue to kind of glide a little bit more. It's very difficult to make a long-lasting change if you don't do it frequently. So I would advise this one's a really great combination of the things I'm going to show you to do in the morning or the evening, or even both. Or if you are at a desk at home and you've been working during COVID, you could even do this multiple times a day. So from the base of the big toe, I've just moved across the middle. You repeat the same thing. That's lifting the toes and then kind of scrunching them up, applying more pressure, kind of modulating as you need to. I can then move to the outside. So I'm lifting those toes up and I'm spreading them. Spread, and squeeze, and spread, and squeeze. And then what you would do is just trace the foot down towards the heel and just see where you need it. Some people are very tender around the heel, where some people get spurs. Maybe their plantar fasciitis can be a really good one for that. Plantar fasciitis really is a problem for a lot of people that have hard footwear, high footwear, etc. So you can roll around the base of that heel. We're going to do some direct work on the toes and the heel in a minute, so we'll save that for then. But for now, let's step away from the ball on this foot. We'll do the same thing on the other side in a minute, but we are going to push our toes into the ground, just bending the toes back a little bit. If you're like me and you've had a lot of broken toes over the years playing contact sports, you can probably get a limited range, but if you work on increasing the range, this often helps improve your walking gait and your run. So this one can be great with just kind of plantar flexing the toes and the foot, trying to get a little bit more range of motion. So be delicate if you've got delicate feet. We are going to make sure that we take a break and then increase the range again. So you're going to do that 2 or 3 times on each foot, applying a little bit of light pressure. If I show you from the side, I'm just taking my toes, and as I say, I'm just plantar flexing those as I try to get a little bit more range in the toes, apply a little bit more pressure. So other foot, big toe, base of the big toe, we are applying a little bit of light pressure. So we're about a 6 or 7 out of 10. You want to scan the foot first, or the 3 out of 10. So you can scan that foot and just find out where you need it most. Again, with all of these protocols that we kind of show you each week, we want you to pick and choose what's going to work best for you. So you kind of make your own mobility protocols and skip over the things you do not need. So toes are up, toes are down, toes are up, and toes down. We're just kind of seeing, whether I need more pressure, whether there's any issues in that area, whether I need to skip over that area if there's nothing there. So on this foot, I'm feeling it most at the base of my big toe, so I'll probably hang out longest there and bring my toes up, toes down. I'm rolling into the middle just a little bit more pressure. Toes are up, toes down. Awesome. Toes are up, toes down. Excellent. So once you've kind of gone over the big toe to the middle of the foot to the little toe, and if you found the other areas you need to work on, obviously you can do it outside the session, roll to the heel just to see what's going on that nearest the heel. A lot of people have tender spots there. I myself have a little bit bruising from hiking yesterday, so I'm probably going to be a little bit more delicate, but it still needs a little bit of love. So you can spend some time there, apply as much pressure as you need. Next thing we're going to do, as we did before, is we're going to do a little bit of plantar flexion under pressure. So probably about 5 out of 10 in terms of pressure there. We're just applying some light pressure to the outside, to where the big toe is, to the little toe. We're going to back off, because we're going to do some more work on the toes in a minute, and then we're going to do the same thing again. So do it 2 to 3 times. We're not looking for a lot of pressure, we're just looking for a slight stretch on the front of the foot, and a little bit of stretch on the toes to plantar flexion. So next thing we're going to do, a bit of a toe stretch. You're going to hold onto your lacrosse ball, keep it somewhere where you can have it available. We're going to use it in a minute. But for now, we're going to take a seat. And if you know this one, you know that it can be a little bit uncomfortable at the start, but once you get into it, it can be a lot more comfortable. We're threading the fingers between the toes, and it's up to you, preference on where you place them. I like to have my little finger on the inside of my little toe, and therefore my thumb is on the outside of my big toe, and I'm going left to right, so my left hand to my right foot. I'm going to start by a little bit of traction away from me, so I'm squeezing my toes and my fingers, and I'm pulling away from me slightly, so I'm just creating some space in that joint. This can really help to increase the range of motion of that joint and increase the stretch, or at least the available range for the muscle to move that joint. So we are tractioning away, and we're starting to do a little bit of a twist. So I'm pulling my toes away from me, and then I'm starting to rotate the foot just to articulate some of those joints, just to add some range to those toes. So I'm squeezing, I'm tractioning, I'm starting to twist just a little bit away from me, towards me. So internal rotation, external rotation, and then I'm relaxing. We're going to do, you can do this 3 times. We've done it, I think, twice now, as we squeeze and rotate. Now we're going to spread the toes by splaying our fingers nice and wide to have a little bit of stretch, and then I'm going to squeeze my fingers with my toes. So in effect, you might feel a little bit of discomfort there because they're not used to doing this roll. They're not like our fingers where we kind of use them every day, so they're not really used to doing this kind of pressure. And then we're stretching, and then we're squeezing. So the idea here is we're trying to get them to grip as hard as we can, and then we're relaxing. So next protocol with this is we traction forward and around. Now we've gone side to side, and now we want to do a little bit of a roll as well of the whole ankle. So you can either stabilize the ankle by putting your thumbs around the medial lateral malleoli and doing it that way, or just below the joint, or you can, if you have good range, you can just play with it and just kind of rotate it through the full 360. And I would advise you to traction at the same time, so you're pulling away as you come around the top corner. So as you do that, pull around the top corner and relax. So next thing we're going to do is we're going to work on trying to mobilize this heel as well. We want to get that kind of loosened up. So thumb's going to go around the top of the ankle bone here, that round part of the ankle here, just to help stabilize. And now we're just going to twist on the heel. So we're just starting to get a little bit more mobile. Now the other option is you can do a kind of ringing position. With the foot, we're going opposite directions with the heel on the top of the foot. That also works well. Be gentle at first, but your feet can stand a lot. So once you kind of get it warmed up and it's moving well, you can do the same thing. We can twist in and out, just trying to increase that range. You can also just isolate the heel like we did earlier. That also works fine. So let's move over to the other side. I'm going to do the same thing on the left hand side. So now, again, hopefully you've washed your feet. Hopefully my feet don't look too bad on camera. We're going to place our fingers in between our toes. If you need to back off and just start a little bit higher up the toes because you have tight kind of feet and toes in this position, that's okay, you can do that. If you need to push down a little bit, that's okay too. We're going to start by tractioning our feet away from us. So we're going to traction away, and we're just going to slightly bring it around the corner like we've done before. So slightly around away from us, we're traction forwards. We're starting to add a little bit of rotation into that foot. We're bringing it around. And again, it's kind of like a 6 or 7 out of 10 on this one. Don't want to go too crazy. The feet are really delicate at first, but once they get warmed up, they're quite hardy. And certain parts of the foot can be pretty tender, so you also want to watch out for that. So advocate for yourself. We're adding that kind of twisting motion in as we kind of come around the corner. Some tractioning, I'm twisting. Traction, I'm twisting. Tractioning, twisting. Tractioning, twisting. Good. All right. So excellent. So we're twisting, 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 twisting. And good. So you do that 2 to 3 times. We've done our traction out and around, and we've done our kind of foot twist. You can now also do our kind of rotations with the whole foot and that ringing motion. You decide which one works for you, which one works best. So the idea here is we're trying to get a little bit more rotation into the foot. You can also play with just the heel as well to try and get that kind of twisting motion. Sometimes that works well for people. Or you can do the ringing of the towel kind of technique, which works really well, where we kind of twist the whole foot, and that works really, really well, turning in and out. You can place your thumb directly down over the medial malleolus and twist away. So you're kind of wringing a sponge, in effect, or a towel, and then do the opposite direction as well. You're just trying to get that foot to articulate nicely, so that as you walk, you're able to grip the ground and also kind of absorb different surfaces as you move. So next thing we're going to do We've done a toe stretch, we've done a little bit of release around the ankles, which is great. We're going to skip over to our hips next. So we've kind of done things a little bit differently today. We've done neck, we've done feet, now we're going to do hips. So I'm going to show you what we're going to do. Now, it's going to get a little bit weird. We're going to feel for our bony bit in our butt. So if you've got family around, it could get weird, but ask them to do it for you maybe, make it weirder. We're going to feel for a bony prominence in our butt. So it's kind of about a hand's length away from our hip line or our belt line, and it's going to feel like a bony prominence on the butt there. That's about where you would want to put the lacrosse ball in this exercise, just so it doesn't disappear and you're like, what is he doing on the bench? That's our intention with this one. We're getting this ischial tuberosity, this kind of area where, the sit bone, kind of where we want to place that ball. It's going to be a good catch-all to kind of release a little bit of the glute and the hip as well. So we're going to sit on that particular area where you found that bone, and it's just going to look like you're hanging out. So two things you can do here, or there's a few actually, but the two what we're going to do is we're either going to stretch our foot out and lift it up to add a little bit more tension through the glute and hamstring, or you can cross your leg over so you add a little bit more of a stretch to the glute max and the glute med, into the glute min as well, but mainly in the glute max and glute med, which are good power muscles in the functional net of the body and also in the lateral net as well, to help stabilize the hip and in extension and lateral stability too. So these are good ones to do. If you're watching and you've just tuned in, I'm sitting on a lacrosse ball, so feel free to do that too. Again, we're looking for that bony kind of prominence. Now this can take about 3 or 4 minutes to relax. So we're going to imagine that we're fast forwarding a little bit. The more you sit on it, the more intense it will get. But the more intense it will get, the closer it is to just relaxing. So eventually if you sit on it for long enough, it will fall asleep. And when I say fall asleep, I don't mean it's going to get nervy. I mean it's going to just relax to basically avoid that tension relationship. So we're just now going to come off that pressure. Come off the pressure, so just put your lacrosse ball to the side for a second. We're going to have a little bit of hip rotation. So right now, you could test for internal, external rotation of the hip. And this is a good way of increasing that external rotation. We cross our legs over. This is my right side, so my right side is a little bit more moved than my left. So you'll probably see that in a second. But all we're going to do is apply a little bit of downward pressure. And we're going to lean back slightly with a tall chest. And this should help open up that hip joint as I push down, 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 down. I'm opening that hip and I'm lifting that heel on my left foot up to help open that hip up a little bit. Now, you can do this on the floor. It works great too, but I'm doing it seated. This is going to have to be a good one for people that have desk jobs. And as I lean back, I'm also pushing the knee away from me and I'm also lifting the ankle. So again, I'll guide you through this one. I'm leaning back slightly with a tall chest. I'm pushing my right knee down. I'm lifting my left foot up. So I'm getting this kind of rotational effect. I'm opening and I should feel a little bit of a stretch on the front of my hip right here. Okay? So let's do the other side. You can repeat this as many times as you need. It's a really fantastic way to get that hip to kind of open up and release in the socket. See, there's a little bit less range of motion on this side, so this is the one we can help cause the most change in. So what we're going to do is sit on this lacrosse ball again to see if that makes a difference. So you want to find that bony prominence, you want to sit on that area, and you have two choices. You can either straighten the leg out and lift it up to see if that helps. You maybe get a little bit of a hamstring stretch and release there if you sit a little bit lower down, or you can stay in that same position around that sit bone area and just see if there's a bit of release for those external rotators. So we're just going to sit here for a minute to see if it releases, in which case just take a few breaths, and as you start to relax, just let your body sink into the lacrosse ball, and then eventually what will start to happen is things will start to move, things will start to glide. You may even find your muscle just kind of starts to relax as it's doing for me. Start to slide to my left now. My hips start to move, so I'll find another position on my lacrosse ball and see if I can get another tender area to relax. So also worth mentioning that you want to do probably a 7 out of 10 in terms of tension. I'm going to cross my leg over now. and see if we can get something else to relax. And we're going to fast forward in a second into our next stretch. Because again, it takes about 3 or 4 minutes to get us to relax. So we take the lacrosse ball away. Let's come down into this kind of hip opener position. We're going to lift we're going to push down on this left knee. We're going to lift this right foot a little bit, and we're going to use the right foot to lift the left leg up. So tall chest, nice and tall. We're going to lean back slightly with the tall chest. We're now pushing down on that left leg. See if anything changes. If you feel a stretch on the inside of the hip right here, we're lifting this foot up. A little bit of external rotation on that hip. See if there's a stretch there as I lean back, and let's just repeat again. So pushing down on this left knee, I'm lifting my right foot up slightly as I lean back with the tall chest, and then I want to add that foot as well. See if there's a stretch inside that hip socket, and do that 2 to 3 times. So now we've got a little bit of a loosened hip. So we've gone neck, ankles and feet. We've done a little bit of sitting on the lacrosse ball to kind of help release some of these rotators. And the glutes as well, so lateral and functional. And now we've opened up the front of this hip, which is going to help to ease any tension you've got while doing things like squatting, etc. Next thing we want to do is a little bit of a low back rotational exercise. We're going to come down to the floor now, so you can leave the lacrosse ball where it is. We're going to come down to the floor. So this is the last kind of exercise stretch that we're going to do. Then we'll stabilize this pelvis as well. So crossing over this leg, I said there's a way that you could do this laying on your back on the floor. There is. Same exercise we do on the bench. This can be a little bit more accessible for some people. You can just lift your hip from this position if you have good hip and low back mobility and you want to kind of do it in an easier way, and you're just going to open this hip right up that way. That's another way you could do it. With this one though, we're in the same position we were in on the bench, but now to get that low back and rotation in, we are starting to bring that foot towards the floor. And you can even add that external rotation of the knee, and bring your arms out to the side just to stabilize, and take a nice deep breath in. And as you breathe out, I want you to make sure that this right foot that's on the floor right now, stays planted on the floor, and you rotate your hip and your low back away from that knee. So we're taking a nice deep breath in, rotating away from the foot. And as I breathe out, I'm rotating towards this right hand. Now you should feel a stretch on the front of this hip. You should also feel it through the low back as well. So I'm now going to change feet. I'll come a little bit closer to the camera so you can see I'm getting this leg across. So the left leg is now crossing over the right knee, or the left ankle is on the right knee, I should say. I'm trying to get some distance between my knee and my chest, so it's externally rotating just a little bit, and we've done the same thing on the bench. I'm now going to drop my foot towards the floor. So now I'm in this kind of pretzel kind of shape, or crossed over kind of crucifix with a leg draped across. And now I'm going to start to feel a little bit of tension on the side. Now this is a tight side for me. It might be different for you, but all we're going to do is take a nice deep breath in. Trying to keep this foot flat on the floor. I'm driving these palms down into the floor. I take about 3 or 4 breaths. Each time that I breathe out, I'm rotating more towards my open side. And now I'm going to come back up. I'm going to bring my legs to square. I'm going to see if I can help stabilize my pelvis a little bit, because I played around with my hip position a little bit. So the easiest thing for you to do is to bring your hands up, squeeze your fists. You might get a loud pop like I just did, and that's just your pubic symphysis just kind of realigning a little bit, and maybe your SI is back kind of a little bit more central as well. The other thing you may want to do is if you feel any slight deviation in the hips, you feel any rotation, it can also be worth adding a little bit of rotational work as well, which we can cover off in another session. But otherwise, that is your Monday Mobility Magic session for this week. We are back again next week for Labor Day and normal time. So if you have any comments, insults, feedback, we'd love to hear from you, because as I say, every week we get people messaging and they kind of let us know what they want us to cover. So if you have something in particular you'd like us to cover, you can either message me at Fresh or Stretch Simon, you can message the Instagram live video that we post afterwards, and the comments I tend to read, so I can get back to you all if you have any questions as well. And otherwise, I will see you next week, same time, same place, on Monday at 11:30 on Labor Day. Thanks very much, and I will see you soon.